and that, essentially they help guide how fast expansion will happen, budgetarily. But yeah, I think that would probably be the best way to do that.
Yeah.
One very quick question. We do have to move.
Okay, so staffing is a challenge. Negotiating with unions is a challenge. The finance that it would cost to pay a city employee, not just currently, but for their pension, a challenge. There are community organizations that are already doing this work, and I know you from another situation, and I know that your experience at that agency is guiding you with all of this work, and I love that you're in this role. Why not have some of the better reputation nonprofits like Thresholds and other places do this work instead of the city, because they already have the structures in place for staffing 24/7, for less cost long-term for the city, for the ability to roll things out more quickly. Why not divert money to the organizations that are already set up to do this work now?
So, I mean, I think that's, obviously there's a few layers to that question, as you know, having been in this field.
Yes, I do.
You know very well the different layers that come with that. But I think one of the major things that we saw as we were kind of looking to roll this out is that it's very challenging to bring in partners into city-operated 911 call center, right? And so the state is funding C4, another non-for-profit, to run 988, right? But in terms of city operations, it is much easier to have city employees enrolled in that program. And so that's kind of the way that we approach this. I don't know that it's always going to be that way, right? Because that 988 operates this way, 911 operates this way. I think that there is going to be, this is really like beginning infancy stages of where we're at with 988 and mental health response embedded in 911, right? And so I think that there will be 10 years from now, we're going to be in a whole different place. We're going to look back on this and be like, oh my gosh, look how far we've come. Honestly, even since September of 2021, I'm like, look how far we've come. And so I can't wait to see like what that's really going to look like. But I do think that it takes really strong partnership with all of our community partners with 988. We do actually facilitate at CDPH a meeting every month with all of our the 590 grantees that are dispatched from 988. So we are connected and working together. There are some times when we've been on calls with other 988 partners as well.
And I love that you're there and some other folks are there that used to work in the community, so you understand what it's like, and so you're taking all your knowledge to the city, and I love that.
Thank you.
Yeah, thank you, Alicia.
Thank you
so much. Thank you.
Yeah.
Manuel and Andy, do you guys want to come up and talk about Thresholds? Matthew, there he is. And here's Matthew.
Hey.
Thank you so much.
While they're coming up, if anyone does want to make public comment, just a reminder, you can sign up. Here. And we'll do that after this presentation.
This one's, I said it's kind of hidden, but this one's right back. So,
You good? Yeah. Thank you, everybody. I'm Manuel. This is Andy. And
I'll wave on camera.
Oh, wave on camera. And this is Matthew. Andy runs the clinic, which we'll talk about briefly. And Matthew's the team leader for the living room, which we'll also talk about briefly. We're from Thresholds. For those of you who may not know, Threshold is a social service agency that we operate. Our home is on the north side of Chicago. We are on Montrose and Ravenswood, but we do have multiple programs across the state. Cook, DuPage, Kankakee, McHenry, and Lake County are some of the areas where we have programs at. Some of the programs that we have are youth, young adult services, homeless outreach services. Most people probably know us through our community outreach. We're in the community helping people that are living with mental illness, providing services to them in the community in which they live. And three of the programs you'll hear about today is I'm the program director of the Mobile Crisis Response Team, which is a fairly new program, just launched last June. Matthew's program, the Living Room, and then Andy, who is opening up a clinic about so I'm going to clear up a little bit of 988 and explain a little bit more because we do work closely with 988. So 988, it used to be the National Suicide Hotline. Now it's just 988. They shorten it so that people don't have to remember an 10-digit phone number when you're having a mental health crisis. You just call 988, and it gets routed to agencies like C4, and I believe there's 3 other providers that run the hotlines, and they provide any sort of mental health services to you over the phone. Some of it could be suicide prevention. It could also be someone with depression or anxiety or any sort of other mental health related, I wouldn't even say crisis, just any more mental health help that you might need. You call the line, you're operating 24/7. You also do text, and also I believe you can do through video, I believe also. So what happens is those calls go to 988, and then we have what we're called the 590 teams, and we're the mobile crisis response teams. So you can call the line, and maybe you need a little bit more help than what they can do over the phone. That's where teams like my team that we operate from Threshold, we go out into a community where the person might be living and provide crisis de-escalation services on site, wherever you may be. We're operating 24/7. We're operating 24/7 right now. I'll speak on that a little bit more in a little bit. But these teams are dispatched from our facility, and they're operating all across the state. So each area of the state has different teams across the different agencies that run all these programs. Here, who can use the service? I'm sorry, this is available for anyone. So you call 988, they will transfer the call. If they can't help you on the phone, they'll transfer a call to a mobile crisis team, and we don't need any information from you. We don't need your name. We don't need your ID or your license, or we need none of that. All we need is you to tell us how can we help you. And we can meet you at your house if you want, or we can go and meet people in the community, or Starbucks, Dunkin' Donuts, at a restaurant, wherever, at the park, wherever people might need help. So now what we do. So there's 2 ways to reach us, and it's a little confusing right now. You can reach us through 988. They'll pick up the phone, and they'll dispatch the call to a mobile crisis response team. If you're in these zip codes here, 606405713, I'll come to the Threshold mobile crisis response team, and we will talk to the person on the phone, try to de-escalate the crisis on the phone. If the person is requesting or they're in severe danger, we will send a team of at least 2 people to help de-escalate the crisis and to help the person come to safely resolve their mental health crisis. One of the person that responds is what we call an engagement specialist, which is someone with lived experience, someone in recovery themselves that has gone through training to be able to relate to someone a little bit better, that can say, you know what, yes, I also myself am battling depression and I can understand how that feels, or I also battled addiction and I know how that feels, I know the difficulties you're going through. So one engagement specialist and one what we call just a crisis worker. That's someone that's their degree is more geared towards psychology and social work. We operate 24/7, 365. We launched June 20th of last year. We went 24/7 as of October 30th, 2022, if I remember correctly. So we go out, de-escalate the crisis, it doesn't matter how long we have to be there. Our response time, we're usually on the scene once we get off the phone with the person in about 20 minutes or less. I think our average is like 18 minutes between hanging up the phone with somebody and being at their location in person. We are centrally located. Again, we're located at Montrose in Ravenswood, so you will see the area codes that we cover. We're right in the middle, so to go anywhere, it's about 10-15 minutes at the most. So we do the crisis de-escalation. We hopefully give someone some resources and some long-term follow-up care that they can receive. We try to set them up with some resources. Again, we're only there momentarily for that night or for that day to help you with the crisis. A couple hours maybe. We try to help set somebody up with long-term services through giving resources, phone numbers, and warm handoffs whenever possible. After that, we will do a 48-hour follow-up call, make sure that the resources we gave the person are working and see how the person is doing, because a crisis doesn't end just there. You still have some recovery to do afterwards. And that is it on my program. I'm going to hand it over to Matthew now to talk about the living room.
You gotta show me how to work this fancy thing.
This one is it forward. This one takes you back.
I don't wanna go back.
You want to run for you?
You got me? He's got me. All right. Hey, everybody. My name is Matthew Tassinari. I'm a team leader for the Thresholds Living Room program, Forever Hope. Our program director, Lena Raimondo, who started the program October 2020, couldn't be here today, so I'm proud to speak on her behalf about this amazing program. So the Living Room program, as you can see, we have the flyer there. This program provides an alternative to psychiatric hospitalization for folks that are in a crisis, right? Whether it's a suicidal ideation they're experiencing, thoughts of self-harm, homicidal ideation, could just be overwhelmed with life, needing to reach out and talk to somebody, lonely, isolated, increase in symptoms, resource crisis. Maybe they need housing, they need things like that, and don't know where to get started. They can come to the Living Room program. This program, is also free of charge, no insurance, no ID required. You don't, just like Manuel's program, you don't even have to provide your name if you don't like, which I think is really cool to break the stigma on mental health, right? Because, it's important to have a safe place that you can go to. And we're open right now 7 days a week. Monday through Friday is 12:30 to 8 p.m. That's for about 7. Weekends we're open. It's a shorter shift. It's 11 a.m. to 5. That's for about 4. But I'm very excited to announce that we will be opening 24/7 in the near future.
Yay!
So I was really excited about that. I think it's going to help a whole lot. We were also told that we would have 2 beds there, so we can stabilize folks and keep people out of the hospital that really necessarily don't need to be there, right? There are times when people do need the hospital, but we make that a less traumatic experience because everyone that works there is a peer like myself with lived experience, overcoming their own mental health and substance use challenges. I really enjoy working in this program. I've been there about 15 months, worked in other living rooms before, and the model is really awesome. It saves a lot of lives. I've seen it do a lot of good things. We can go to the next one. Here's some pictures here. In order to understand the living room, you'd actually have to go to the living room. Kara's team has been there, that's for sure. Representative Ann Williams has been there. You have to really be in the space there. We have a full kitchen, couches, TV, massage chairs, real dim, calm lighting, so that when you walk in, it's very calming. Also, we have a fish tank there. That's our fish, Boss Hog and Cletus, which the guests really enjoy. They enjoy that. When someone comes into the center there, they are welcomed as a guest, not a patient, not a client, but a guest. Oh, there we go. Hey, so there's some outreach and stuff we've done, because we really want to get the word out there. That's why we're here today, right? So there's some pictures there. Geez, I was like, am I in everyone? No, I'm not in everyone. That's good. So the location's 4423 North Ravenswood, Ravenswood and Montrose. We're not too far. We're here in the 19th district. And then the phone number, the main number is 773-537-3601. You can call as well if you're in a crisis, but we really encourage folks to come in and experience the living room itself. You can also call as well. No appointments needed. Walk-ins are accepted. Referrals are accepted as well. The best thing to do is just call, if you have any questions afterwards, I have some business cards, things like that. Please reach out, as well as flyers. Yeah.
There's flyers for
Oh,
most prices.
there we go.
And living room up there, you have Spanish also?
Yes, yes.
Spanish and English for both.
Yep, we have bilingual services for both. So I'll hand it off to Andy Brower.
All right, cool. I'm Andy Brower. I'm the program director, one of the program directors at Thresholds. We're all in the same building, which is kind of unique because Thresholds, as we talked about, has quite a few different locations. So it's nice to offer all of our services in collaboration with one another and a lot of communication and can cross-refer to one another. So the program that I am leading now is called the Certified Community Behavioral Health Clinic. It is a federal initiative to bring comprehensive person-centered care to behavioral health care to folks regardless of insurance. So it's the whole model is to improve access to care. And so it's really available to everyone, but the target population is folks who have no insurance or perhaps have Medicaid, which is very hard to get behavioral health care, specifically substance use and individual therapy and group therapy. So those services are mainly what we're targeting when I talk about our part of the CCBHC. The things that the CCBHC does as a whole is a lot of what Thresholds already does. Just the person-centered care model, the case management piece, psychosocial education, crisis services, as we've discussed here, are all part of the CCBHC practice. But the part that's new for Thresholds is really the individual therapy piece, the group therapy piece, and an enhanced substance use piece that's really kind of new for us. The other thing that's new for us at Thresholds is across the lifespan care. So we do have youth programming right now, but our youth programming and our adult programming is separate systems really right now. And our youth program is youth, more like teenagers and above. This is through the lifespan, so children through adults. There's also a component to this as an integrated care piece so that we know people's physical health, what's going on them physically as well, and providing access to physical health partners. At 4423, we have a pharmacy as well as a FQHC, Federal Qualified Health Center, called Tapestry 360, and they're our partners, and they'll be helping us meet that component of the requirement for the CCBHC, as well as have been helping us for a long time in serving our members. The FQHC model, if you're familiar with it, is very similar to what the CCBHC is doing. FQHCs were put in place to provide better access to care for folks that have, again, no insurance or insurance barriers, other kinds of access to care barriers. So staffing and roles here, I just want to kind of highlight who we have right now in some of our programming. We've got 5 therapists. We're also, we'll be starting with 3 fifth-year PsyD interns in September. We've had a partnership with Adler, who for some years at Thresholds, but those folks will be part of, we've enhanced it and they're now part of the CCBHC services. We have a nurse that's going to do care coordination and kind of linkage to various health needs. Peer health navigator, which is another component, another individual with lived experience who's helping people along the health journey component. Physical health mostly, but also some mental health or substance use services there as well. Of course, a front desk manager to manage the clinic, as well as a clinic director or a clinic leader. Kind of already mentioned some of the roles that we'll be doing as far as providing an integrated healthcare piece, as well as with the healthcare piece, just really screening and monitoring people's progress on addressing those health concerns, right? Folks with severe and persistent mental illness, which are Threshold's primary population currently, although anyone can access these services. Again, we're not only expanding age-wise, but we're also expanding to anyone who really is looking for individual therapy services. Doesn't have to be our current population, which is, again, folks with more severe and persistent mental illness. So helping them through that health journey, really, like, so someone shows up, again, folks with severe and persistent mental illness don't often seek or receive as much physical health care as the rest of us. And so the peer health navigator and the nurse will really be helping coordinating, trying to ensure that those services are met, and so that we can help address the mortality, why can't I say that right? Mortality rate, and a gap that's for the severe mental illness population are about 10 to 20 years earlier than the rest of us. So, all right. Current programming, where we're at right now, we are currently serving our thresholds population with some of these services, and we've just hired the staff that we've gotten here really. We're set to really expand to the community probably in early August. Our children's services and family and couples services, which will be all part of the package later, we're hoping to really launch in September, as well as, I guess I mentioned the children, but adolescents as well. And plan to grow as we need it. I said we had 5 therapists right now, but the hope is to continue to hire as long as we're seeing that need that's unmet, and so that we can really address that access to care barrier. So I think that's all I had. That's all of us.
Awesome. Thank you so much.
Yeah, I feel like in the name of time should be. Is there just one quick question? Is there anything that we could do, again, if people are interested in advocating for expansion of services, that would be helpful for the community to know?
Spread the word out, spread the word, right? The resources are there. We want to go and be on calls and help people. We know that the need is there, right? And we don't know if people know enough about the mobile crisis response programs, which are new, right? And one of the goals is to take some pressure off the police so that we are responding to, we're better equipped to respond to mental health emergencies, right? So getting the word out and getting our number out, our numbers in the flyer. I would say that for now, calling our direct number is the easiest way to go about it. Because there's some, I wish Kelsey was here from C4, but with 988, depending where you're calling from, it might go, it gets routed to a different state, if you have an out-of-state area code. So yeah. So if you need immediate help, call our number on the flyer is the best thing I can tell people. And pass the flyers out to your friends. Let me know. I can hand out my business card. There's any more community events like this where we can go present and give information out there. Please let me know because we want to get the word out. Yes.
Every library has a bulletin board. You can post it
Yes.
on there, and also I would have it. Have the alderman put it on their website and have it mention it in their
Thank you.
newsletters. And the Cook County Commissioners too.
And just to uplift that point is that, this expansion of mental health services we see as an important piece of that public safety umbrella of taking some of that off the shoulders of the police, allowing them to really respond to the more serious violent crimes, and let trained professionals who can respond to the other types of mental health crises that are occurring. So we see this as, working to support police officers as well as community members, as well as the overall goal of an increased public safety system that is more effective for everyone.
And I just thank you so much to Alicia, CARE, and for Thresholds for being here. One more round of applause. What I find so exciting is that we're part of a time where we are building these new institutions to deal with public safety issues. A reason we made this our second meeting ever is because our district, the 19th district, has the second highest number of mental health crisis calls in all of Chicago. So it's a real issue, and it really is a resource strain on our officers. And we're here to help expand and figure out what works. Sometimes we'll figure out what doesn't work, and also figure out how we can get the public involved in building up these other pillars of public safety response. So thank you very much for engaging in that conversation.
All right, and as we wrap up, as I mentioned before, we do not have any votes, so nothing here. Want to announce the next meeting, which is going to be July 18th at 6:30 p.m. That's going to be at the Lincoln Park Presbyterian Church. which is 600 West Fullerton Avenue. You might notice that it is the southern border of the 19th district. What we're trying to do is spread the meetings around so that we have as much attendance as possible. So please make a note of that. We will also be blasting that through our emails, so be on the lookout for that.
And we're having another speaker come as well, so it's not just me us speaking, we're really trying to bring in different agencies. And this is one that works with violence prevention and gang violence throughout the city, so it should be really interesting.
And now we can move to public comment. So the way we'll want to do this is there's just a reminder of the rules of engagement and just how we want to approach this. Everyone will be getting 2 minutes. We can go up to 20 minutes total. We're gonna randomly select speakers, and then we just want everybody to be respectful, no harassment, no disrespect will be tolerated whatsoever. And so let's start with a public comment. I'm gonna call there's 4, so I'm gonna call everybody up, and if people want to line up over here, come up to the stage on this side, and then I'll start the timer for those people that have public comment.
And if anyone else, as they're coming up, if anyone else has public comment, you can just fill out a sheet over by Amy.
Yeah, and so Isaac Troncoso can come up, Alma Pricer can come up, Mary Didek can come up, and then Robin Hammond can come up. If you guys want to line up, that's the order, and then I'm gonna put the 2-minute timer on the screen.
Where should we stand?
You can come up.
Oh.
There's the stairs here if you want to come up. And then when you start to speak, just state your name and spell it out. And then after you spell your name, that's when we'll start the 2-minute timer.
Great. Thank you so much. Really appreciate you guys having me here. So my name is spelled ISAAC, T as in Tom, RONCOSO. And I'm Isaac Troncoso. I'm one of the commissioners on the Community Commission for Public Safety and Accountability that you've been hearing so much about, the 7-member body that, among other things, is going through the superintendent search. But one thing I really wanted to talk to you guys about, and super happy to be here because this is actually my home police district, so I live in Lakeview East, is the police board. So can I get a quick show of hands on who's familiar with the police board already? Okay, good. So maybe a few people. Basically, the police board is the 9-member body that decides on cases of officer misconduct when COPA, the chief administrator, and the superintendent disagree. So if there's an incident, let's say, with an officer, and COPA says the officer should be fired, superintendent says the officer should not be fired, the police board is basically the jury that rules who's correct, what should happen. So we have open applications for this board going on right now on a rolling basis. The commission is in charge of nominating people to this board. So the main criteria, which I'll pull up, is to have 10 years of documented full-time experience in one of the following fields: law enforcement oversight / police accountability, public policy, social work, psychology, mental health, community engagement or organizing, and civil rights. Attorneys are also preferred because 4 of the 9 seats have to be attorneys. So that's more sought after, but everyone is welcome to apply. So again, this is a really important position right in the heart of police accountability. And we have a couple of vacancies coming up in August. So we really need the community to apply for a seat at the table here. So if you have any questions about that, I'll be hanging out in the back, but I appreciate you having me here.
Thank you.
Of course. All right, Alma, do you want to come up? All right, and just state your name and spell it out, and then I'll start signing.
Yes, it's Alma Kreuser, that's Kreuser. Okay, just first I want to say, beautiful presentation. I love it. It's great. And so I just want to say, I'm an NPI ambassador. I do attend the CCPSA meetings as much as I can. I haven't heard from them in a while. And I do participate in, just recently I started going to restorative justice meetings and peace circles, because I think it's important for me to understand fully how everything works, before I, insert my opinions on anything, because I need to fully understand all this. And that said, I should say that the restorative justice group in Avondale really needs volunteers. So if anybody's willing to do this, I have a contact and I can share it with the group here. And they can, they welcome, they need more bodies. So the other thing I want to mention is, so in the last meeting, I brought up some laws that get passed without, I don't hear about it, so I imagine others don't, like House bills, Senate bills, and I mean, I rattled out a couple of them, but how can you help us know about these laws before they get passed, before they even make it to the floor? Because it's important that a lot of these rules are interfering with our police doing their job. It's getting worse. And the other one. Oh, and then the whole, I'll go back to this, the quality of life issues. I think I'm gonna request, in my opinion, I think it's something that the DCMs need to work with the aldermen to go out and physically talk to neighbors so they understand what the laws are. And I'll throw out a couple of examples. You don't have it as badly in the 20, what is it? I'm in the 47th ward. It's not so bad there, but in 25, because my family's there, it is horrible. Every week, you have bands playing, live bands in people's yards from 9 to 5 a.m. It's non-stop, and you have people blowing fireworks. Oh shoot, sorry. So sorry.
Take 10 seconds to wrap it up.
Oh, so sorry.
It's okay.
Yeah, so just reminding residents that there are rules to be followed. And it's important that they hear from the alderman that before the police go and show up, so that they heard from the alderman. So now when the police show up, it's not a surprise. All right, that's it, sorry.
No worries. Are you married or what?
Yeah, Mary.
Okay, Mary, please come up.
Thank you. Hey, everybody. Hi. Yeah, Mary Dudek, D-U-D-E-K. And I have a comment and a question. So I do not live in this district, but I work for healthcare organizations that do work in this district. And because of the particular topic tonight, I really wanted to make sure I came here to be able to hear all of this. And so my comment to you all is I think I'm probably going to be your first groupie. You all did a marvelous job of presenting complicated information and really showing that you're being representative of the community. And so I am expressing gratitude for all of that and a bit of awe that you pulled all this together, and my understanding that this is not your full-time jobs. And then the question that I have for you is, I want to know, is there a template that you were given or some guidance? I mean, this is a new organization. Are you all following something, or is this just what you all decided you were going to do for your district? So if you could speak to that. Thank you.
We typically aren't gonna address public comment, but we can address that real quickly. I think we have been working together for a full year because we campaigned as a team. So I think that's really helped us kind of share a unified vision and kind of work to see where each of us excel and how it kind of works together as a team. But we are, and we also have been envisioning what this could be for a full year at this point, probably more than that, at whatever month we're in at this. So it's taken a long time and we're ready for it to evolve and we're open to that. But yeah, I don't know.
I guess a quick answer to, is there a template? No. This is brand new and we're figuring out as best we can. I hope we're doing a good job. But we welcome your feedback on how we can do it better, what else we can address, how we can mix up the format as we go forward.
And then
Thank you.
Robin? Yes. Okay, we have Robin Hammond. State your name, spell it out, and then I'll start the timer.
Okay, great. Hi, my name is Robin Hammond. It's ROBIN HAMMOND. And I live in the neighborhood, I work in the neighborhood, and I just wanted to first say thank you for bringing all these groups together. It's fantastic. And I wanted to say thank you for Thresholds for the work that you do. It's wonderful. The CARE program, I'm very excited about it. I'm a little concerned about the pilot, the hours. I do hope there can be expansion there. And I'm also grateful for the CIT training that our officers receive as well. So I just wanted to say thanks again for amplifying all of this, and thank you for the work that you do. I really appreciate it on a personal and professional level. Thank you. Thank you.
Thank you.
Any other public comment? Good.
Yeah.
Hi, my name is Megan Green, MEGHANGREEN. And I just want to plug for next month. I work at the Institute of Nonviolence Chicago. We are a community violence intervention organization that works in West Garfield Park, Austin, Back of the Yards, and Brighton Park. And we will be speaking next meeting. I've been to both of these meetings, and there's a great show each month to learn new things in our 19th district. And I just want to give a plug for next week where you can hear what we're doing in the city and other ways to reduce violence. So.
Thank you.
And again, that'll be July 18th, Tuesday, 6:30.
Oh yeah, Tuesday, 6:30, July 18th.
And then with no more public comments, just want to give it over to Jenny just to give a few calls to action, and then we'll call to adjourn.
Okay, like I said last meeting, every good organizer ends with some calls to action, but we also understand that it's getting super late, and so we also want to end our meeting so people want to come back to our meetings. So I will say one quick call is what's in that blue box. Just make sure that you are sharing this information that you're learning tonight with 5 friends. Do the best you can to really be an advocate for these services so that we can really help create this more robust public safety system.
Yeah.
Thank you.
And you can read those real quick, and we would love it if you did all those things as well.
Again, everything will be posted online at the CCPSA website. And then finally, you can email us, as we mentioned earlier, 19thdistrictcouncil@gmail.com, or visit our website. And then before we adjourn, I do want to just say a couple more thank yous to the Threshold team, Manuel, Andy, and please extend our thank yous to Matthew, and then to Alicia Warren that was out from the care team, but also Judy Jordan, thank you so much. She organized us this space, and it's been wonderful. So thank you so much to you and Weiss Hospital. And then to everybody here, thank you so much. I'm going to call to adjourn at 8:13, and so that is our meeting for June. Thank you, everybody, for coming out.
Thank you.
No, I know, I come back when I do the comments.
Yeah.